So when these are the helpful tips for a way of maintaining our oral part. So I'm going to first explain to you what we mean by dental care. Dental care is the maintenance of healthy teeth, and may refer to oral hygiene. Dental care, it may refer us to oral hygiene. And oral hygiene is the practice of keeping the mouth clean or smart or healthy. Like so, oral hygiene, we deal with the oral part. So oral part consists of teeth, tongue, and other parts, gums. So that's the oral part. So I'm here for the basics of helpful basics or tips which will help us maintain the things so hygienic. So brushing, the first one is brushing your teeth twice a day, at least twice a day. When we do it, more so after the first meal in the morning and after your supper when you're going to sleep, that is better. So don't give a chance for the bacteria to do something about your oral. Some of us, we have good oral, how can I phrase this? We have good oral arrangement, but we spoil it when we don't maintain it very well. So we have to maintain it so that we can at least appreciate the good who made it for us to be so well. So secondly, we have to clean between the teeth regularly, aiming for one a day, once a day, at least once a day. You clean the gaps or the spaces between the teeth, your teeth, tooth, then that space in between. At least clean it using, at least if you can't afford the other mechanisms, at least you can use a thread. At least you clean, at least in a day, clean it once when you're going to sleep, more so after your supper, brushing, then you're going to bed, prayers, then so at least clean it using a thread there, cleaning between the teeth. So thirdly, like visit a dentist for routine checkup. I think we have to give jobs or to give work to our dentists. You have to do with your dentist, I think, so that you can check up your life, your dent, your oral part, how is it standing, and ask questions. I feel this, is it normal, so that you can be guided. So some of us, diseases come to us which can be solved easily, but we delay and we come up to our dentist when we cannot even be helped. So I think visiting the dentist at least in a month, try to go there. So drink fluoridated water. So those who won't be able to understand fluoridated water, you will be like, use your phones, I think. And the next video I'll be coming with the more details about fluoridated waters. Don't smoke. Pardon this. Don't smoke for the better of your oral part. You know, when we smoke, we spoil our gums. More so the gums are more affected by the smoke, cigarettes, whatever you smoke using the mouth. So I think we should stop smoking. Next is, at least if you are planning to become pregnant, have a dental checkup. Are we at par, or I've left someone back? if you're planning in that process, more so babies, mothers who are pregnant, at least for you have to visit your dentist at least after 2 weeks. You have to go there for a medical checkup for your dent. At least you have to visit your dentist, because when we are pregnant, there is that organisms which are produced into our mouths, which at times become poisonous to us, or which become a challenge to us and turn to spoil our mouth or our dent part or our oral part negatively. So if you're pregnant or if you're in that process, visit after 2 weeks, so that they can take at least a checkup for you. Next is eat a well-balanced diet. Some of us, when we talk about well-balanced diet, some of you think balanced diet is something, good foods. But here I mean eat foods which are not so, how can I phrase this, like their pH, like when you eat these foods, they should not contain more acids. More so, there are foods which we eat which are more acidic, and those foods I won't mention, because I'll be like attacking some of the companies and some food stores. So like stop eating foods which are so acidic. More so if the pH goes up to 3%, 3 degrees. So there, at least you should eat foods below that pH. And if you do the other thing, at least you have to rinse quickly the mouth, or you should be having another food which can at least decrease the pH for the other food. So about the gums, someone asked about the gums. Gums is all about eating a balanced diet. Do not smoke. More so, just quit. If you've been doing it, quit from smoking and limit sugary foods for our gums and for all our oral part. Limit sugary foods. You will know sugary foods. There are sweet cakes, whatever containing sugars. Limit them. Don't quit from them, but limit them. Take a few in a moment. At least when you take, rinse, clean the mouth, so that you can maintain our oral mouth so better. I'll be glad if you follow and like this and you comment there, and you call other friends to also learn and share it to the public. I'll be so glad. Thank you. It has been Dr.Eaj Eric. Be blessed.